Good afternoon, everybody. My name is Dr. Murli, and I am the Chief Surgical Oncologist of CION Cancer Clinics. Today, I will be speaking to you about hysterectomy and its varieties. The word hysterectomy means removal of the uterus. This is one of the commonest operations performed all over the world for gynec problems in women. Hysterectomy is usually performed because women experience symptoms such as bleeding, pain, discomfort, and discharge. So these symptoms in women may require evaluation and hysterectomy for permanent cure. The symptoms which I have described usually occur because of several common diseases such as what is called DUB, dysfunctional uterine bleeding, in which the uterus is normal but bleeding occurs. In addition to that, you can have fibroids, which are small lumps which occur in the uterus and cause severe pain and bleeding. And the third is a condition called endometriosis, which is again a significant condition which can cause severe bleeding and pain. So to relieve these symptoms, medications can be used initially, but finally many times it is needed to do a hysterectomy and remove the uterus totally along with the fibroids or endometriosis within it for cure. So this hysterectomy can be done by three methods. Traditionally, we do open surgery, which the incision is given like that of a caesarean incision and the uterus is removed. It takes about an hour or so. Nowadays, we have much more sophisticated techniques such as laparoscopic hysterectomy, in which we do hysterectomy by inserting 3 to 5 millimeter size ports and instruments inside the abdomen, and the uterus is removed via the vagina, thereby having no incision needed in the abdomen of the lady. So there is, without having a incision, the uterus can be removed. That is laparoscopic. And nowadays we have robotic hysterectomy, which is the same as laparoscopic, but which is done with the help of robotic arms, which are much more precise and much more user friendly, both for the surgeon as well as for the patient. So these are the three types of techniques used to remove the uterus. Cancer of the uterus can occur in two portions, either of the uterus body or of the cervix, that is the mouth of the uterus. So these are divided into cervical cancer, which is cancer arising from the mouth of the cervix, and endometrial cancer, which is cancer arising from the body of the uterus. So both these conditions may require hysterectomy for cure. In fact, will require hysterectomy for curative purposes. Along with surgery, after the final report comes, you may require additional radiation and chemotherapy, depending on the stage of the cancer. However, the basic treatment is hysterectomy, in which the uterus, along with the surrounding tissue, the fallopian tubes, the ovaries, and a portion of the vagina are removed so that the disease can be removed totally. Along with that, we have lymph nodes in the surrounding tissues which also need to be removed to make sure that the cancer is completely extirpated. So this is what is called as a radical hysterectomy, which is much bigger than the simple hysterectomy used for simple conditions. Therefore, a radical hysterectomy is a major procedure which can be used to cure either cervical or endometrial cancer. So in here also there are multiple techniques which can be used. One is the classical open surgery, which requires a relatively big incision and open methods of removing the tumor, after which the abdomen is closed in the traditional manner. Nowadays, we also have laparoscopic and robotic hysterectomies which can be done using laparoscopic techniques, minimally, also known as minimally invasive techniques, and robotic, again using minimally invasive techniques. So these two are much more user friendly for both the surgeon and for the patient, because this avoids the use of an incision, decreases blood loss, and encourages early patient recovery and discharge. Along with the hysterectomy, based on the final report, the patient may also need to go for radiation or chemotherapy as necessary. The symptoms of bleeding and pain and discharge are very important, especially in a postmenopausal lady, and should immediately be brought to the notice of a doctor.